In this video, we're going to look at how to properly mix insulins when you're going to give them sub-Q. Now, typically we'll mix an intermediate or long-acting insulin like NPH with a shorter-acting one like regular insulin. The big rule to remember is that you always drop clear, then cloudy, or longer-acting before the short-acting. So first step, of course, is to calculate the total required volume of medication needed. In this case, we're going to use an example order of 10 units of NPH and 5 units of regular insulin. So that's 15 units total. So the first thing you want to do is open both vials and clean the top of both vials with an alcohol pad. To avoid contamination, you can use an individual alcohol pad for each one. Once you have your vials clean, you want to grab your insulin syringe, and then you're going to draw back the total amount of air that you need. So in this case, that's going to be 15 units. Now, insert the needle into the NPH vial and inject the dose of air for NPH into the vial, in this case, 10 units. So inject the 10 units of air into the NPH vial, and then you'll still have 5 units of air in the needle, and you can remove the needle from the NPH vial. Then you're going to take that 5 units of air and inject it into the regular insulin vial. Once you've injected that air into the regular insulin vial, you can invert it and draw up your 5 units of regular insulin. Careful not to overdraw here. Draw slowly and gently just to 5 units. Then remove the needle from the regular and insert it back into the NPH vial. Invert it and draw back exactly the prescribed dose of NPH insulin. So in this case, that's 10 units for a total of 15 units. If you accidentally overdraw, you'll need to start over because you can't inject it back in and it's already mixed. So remove the needle from the NPH vial and prepare to administer it to the patient. If you aren't administering it right away, recap it and label the syringe with the drugs and doses, date, time, and your initials. So to recap, you're going to put air in NPH, air in regular, draw up regular, then draw up NPH. Or if you want to say clear and cloudy, you're going to go air in cloudy, air in clear, draw up cloudy. I know it seems silly, but it's super important because it helps us prevent cross-contamination of the vials and it makes sure that you get the right doses for your patient. Now go out and be your best selves today. And as always, happy nursing.